cancer-free, and just comparisons with surgery, with different forms of radiation. A lot of people falsely believe if you cut out the prostate cancer, you're home free.
Right.
So wouldn't that make sense? If you cut out the prostate cancer, you're home free.
Sure.
You have a prostate, you cut it out, you put it in a bottle.
Right.
I mean, you think you're home free, right?
Sure.
Sounds good.
Okay, so what happens to those men? Let's just talk about it for a minute before we bore everyone to death about prostate cancer. So tell me, let's just say you go to the most famous surgeon in America and you've got a Gleason 7.
Yeah.
Okay, so what's your chance of being cancer-free with a Gleason 7 5 years later? If you have the most famous surgeon, the cancer is localized, there's no evidence of spread, it hasn't gone anywhere.
Right.
So if he gets that in the bottle, what's the chance of being cancer-free for a Gleason 7 5 years later?
I guess 40%.
John?
55.
Well, you're closer, 66%.
Okay.
So you think about it, already a third of the men have relapsed within 5 years after radical surgery for prostate cancer. So why do you think that is?
The relapse?
Yeah, why does cancer come back after surgery? If you cut it all out...
Was it really all cut out?
Well, obviously not.
Right.
Okay, so he wanted to cut it out, but he didn't cut it.
Right.
So did he leave cells behind?
Right. That's what I'd go with, doctor, yeah.
Did he spread it by the surgery? Did him opening up and mucking around spread the cancer? Rob, what do you think?
Yeah, I mean, it's possible that he didn't get it all out. It's also possible that it's already spread to other areas.
Okay, so if it's already spread to other areas, that means if we treat the patient with radiation or radiosurgery, and they treat the patient with surgery, we have to kill every cancer cell. They just have to remove every cancer cell.
Right.
So if it's already spread, our results and his results should be about the same.
Right.
Right?
Yeah.
Okay. So if you look at our book, page 14. It's Gleason 7, and it's a comparison of our patients versus major universities in Philadelphia and Boston, and we know what that means, Philadelphia and Boston, right? So if they have surgery for Gleason 7 or PSA 10 to 20, the best results 5 years later are 60% with surgery. Now, what do you think our results are in the same category?
71%.
Go with 78.
90.
Wow. There you go.
Okay, so if our results are so much better than the surgical results, it would tell you that...
It almost seems like a no-brainer.
Yeah.
Well, what would you say? What's the answer?
What's the answer?
Yeah, it's no-brainer. What's the answer?
Radiosurgery.
Yeah.
No, but that's the answer of treatment.
Right.
Why are we so much better?
You localize. You attack the cancer in a localized setting.
Non-invasive.
Well, I think that's true, but I don't think that's the reason.
Okay,
so think about it. The cancer's in the patient's body. We have to send in rays to kill it, and the surgeon just has to remove it. Okay? And the surgeon is successful 60% of the time. We're successful 90% of the time. So why is that? I think that the reason is that the surgeon is actually, without his knowledge, spreading the cancer cells. And as you get higher Gleason scores, you're more likely to spread the cancer cell. Because really, it should be easier for the surgeon to cure the cancer because he just has to remove it. I have to kill every cell. There's billions and billions of cells I have to kill. So to me, the fact that we're 50% better than surgery means that the surgeon, unfortunately, is probably spreading those cells when he operates. So we're 50% better than the surgeon in that category. And then I just want to get to something else. So at Gleason 7, with the most famous surgeon in America in Baltimore, so I told you that he's 66% chance of being cancer-free for Gleason 7 at 5 years. At 10 years, what do you think his success is for his patients, his patient success?
It's 66% after 5 years. I'm going to say it's going to go down to 59%.
I'm going to go with 46%.
It's 46% exactly.
Rob on the money today.
How did you know that?
It was a lucky guess.
You didn't look at the booklet?
No.
He's cheating,
it's 46%. So think about it. After surgery, the cancer is still relapsing and causing recurrent cancers 5 to 10 years later. So it's incredible.
Right.
So the majority of the men who have surgery for Gleason 7 actually relapse in America. And that's what we try to tell people. Think about the treatment that you're getting before you get it.
Right.
What about the safety, too? I mean, I'd rather have radio beams
Well, that's another issue. I mean, there's a whole issue of sexual function, urinary function. Statistically, about 1% of men die during radical prostatectomy, and I've seen that. I've seen men die during radical. So those are all in our favor because people don't die during radiation. You know, you just lay on a table and the beam moves around you and you get up and you go to the movies or you go to lunch. Right. So ours is like a picnic. And sexual function is much better. Urinary function is much better. But that's important for men, but that's only additive importance. The fact is, I believe we can cure more men than with surgery. And the data shows that, especially when you get to Gleason 7, 8, 9, 10. So we'll talk about it more in the future, but that's for the gentleman who called last week at 7:01, a minute after the show ended. Why don't you talk about proton beam versus you guys?
Gotcha.
So there you are.
Didn't want to come on the air with you, doctor.
Didn't want to come
Sure,
on
it's not
the air.
personal.
So what else is new here this week? Have you had any cancer patients that you've seen, or friends, or neighbors, or questions that have risen because of this show?
Fortunately for me, no. It's been a good week in that category.
Well, you're lucky.
What about you, Rob?
I've seen one patient who had a hepatocellular carcinoma from hepatitis C virus.
Okay, well, that's a very common cause, hepatitis C, cirrhosis.
Right.
And we talked about hepatocellular cancer a couple of weeks ago on the show, and we treated, and we'll talk about it again. I actually wanted to speak to a woman in Long Island who said, why didn't you talk about my disease? And she called me last night and said, you didn't talk about my disease. So I want to talk about one more patient who raised the topic. And this woman has a meningioma around her nerve for her eye, for her vision. So it's called an optic nerve meningioma. And we're going to talk about that right after this break from our fantastic sponsor. For prostate cancer treatment, results and quality of life matter. Hi, I'm Dr. Gil Lederman from Radiosurgery, New York. Our enviable record includes treating thousands with prostate cancer. Critical to every man with prostate cancer and their loved ones is quality of life, urinary and sexual, and great treatment data while avoiding surgery. Treatment here is outpatient, with most insurances, Medicare, Medicaid accepted. First in America with radiosurgery. For cancers from head to toe, we have the expertise to hit the cancer. Our fresh second opinion could change your life. For prostate cancer treatment, call 212-CHOICES, 212-CHOICES. Radiosurgery, New York. Super conveniently located in Manhattan at 38th and Broadway, hits the prostate cancer. Call 212-CHOICES, 212-CHOICES to hit the prostate cancer. For new or recurrent cancers, Radiosurgery, New York specializes in non-invasive cancer treatment choices. First in America, first in New York, first for you. Body radiosurgery cancer treatment. Decades of experience with primary and metastatic, large or small cancers. Cancer treatment from head to toe, including prostate cancer. Our innovative radiosurgery hits the cancer with no cutting, no bleeding. Hi, I'm Dr. Gil Lederman. We're the cancer treatment radiosurgery pioneers, with possibly a second cancer treatment chance for you, even if chemo, radiation, or surgery didn't work. Our cancer treatment is outpatient with most insurances, Medicare, Medicaid accepted. Minutes could change your life. Call me at 212-CHOICES, 212-CHOICES to hit the cancer. Radiosurgery, New York. We're super convenient, 38th and Broadway in Manhattan. Radiosurgery, New York. Call 212-CHOICES, 212-CHOICES to hit the cancer.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WABC studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. Hey, Dr. Lederman, we're back.
So we're back, and we're talking about optic nerve meningiomas. John, have you ever heard of a meningioma?
I cannot say I have, no.
Okay, so meningiomas are benign, usually benign tumors. There's actually 3 forms of meningiomas. They're tumors of the coverings of the brain or of the spine. And most are so-called benign. Benign means that it doesn't travel and cause harm or death. But obviously brain tumors can cause harm just by growing. So a benign tumor of the brain can cause great harm. So this woman had a meningioma of her